Hello everyone. Today we are at base. Today we are talking about the National Health Service. Thank you to all the subscribers. Gosh, I value so much. If you are watching this and you have not yet subscribed, please go ahead and subscribe. It is free and you are supporting me. Thanks. The National Health Service is a British national treasure, and it is highly valued by the British citizens since its establishment in 1948. This is the pride of England. The strengths of the NHS includes its workforce, who continuously go above and beyond to support patients. Their selflessness and commitment is amazing. They go extra mile every day. Another huge strength about the NHS is that it is a public-funded health service and has strong central leadership. We hope politicians don't mess it up. Public support for the NHS remains high despite the enormous challenges it is facing. Staff diversity is another key strength of the NHS, which is partly due to its international recruitment, and the United Kingdom's recruitment of medical and nursing staff remains one of the highest in the world. Like other healthcare organizations worldwide, the NHS has faced challenges over the last few decades and has somehow survived most of these challenges. The main challenges faced by the NHS historically have been staffing retention, bureaucracy, poor staff morale, poor communication, extremely poor pay especially for Band 2 staff. There is the permanent backlog in clinic appointments. All the negatives done. The NHS is the best healthcare system in the world. Think about it. This is a system whereby the patient does not have to worry about money ever. All the patient needs to do is concentrate on getting better and return to work quickly. The value of the National Health Service can be evaluated from several perspectives, primarily focusing on its affordability, accessibility, quality care, and societal impact. The NHS is the best thing that ever happened in Britain. I do realize the system has been abused by foreigners who just turn up for treatment. That window can be permanently shut by asking all adult patients to produce their national insurance number when they register with the GP, and physically show it when they go to hospital. The international students who come here to study have already been charged to use the NHS. Let us continue. Affordability. Universal coverage. The NHS provides healthcare to all UK residents, funded primarily through taxation. This means that individuals do not face direct costs at the point of use, which can prevent financial hardship due to medical expenses. Cost effectiveness. Compared to private healthcare systems, the NHS has been shown to deliver care at a lower cost per capita, although it faces challenges with funding and resource allocation. Accessibility. Equitable access. The NHS aims to ensure that all individuals have access to healthcare services regardless of their socio-economic status. This is particularly important for marginalized communities. Preventive care. The NHS emphasizes preventive care, which can lead to better health outcomes and reduced long-term costs. Quality of care. Height standards. The NHS is renowned for its quality of care, with many services meeting or exceeding international standards. However, experiences can vary based on location and specific services. The NHS contributes significantly to medical research and innovation, which can improve treatment options and health outcomes. How about public health? The NHS plays a crucial role in public health initiatives, vaccination programs, and health education, which benefit society as a whole. Economic contribution. The NHS is a major employer and contributes to the economy, supporting jobs and local economies. Some challenges. Funding and resources. The NHS faces ongoing challenges related to funding, staffing shortages, and increasing demand for service, which can impact the quality and timeliness of care. The elephant in the room. The waiting times. Many patients experience long waiting times for certain treatments and procedures, leading to frustration and concern about access to timely care. Whether the NHS is worth it ultimately depends on individual perspective and experiences. For many, its benefits in terms of accessibility, affordability, and overall health outcomes outweigh its challenges. However, ongoing reforms and investments are necessary to address current issues and ensure its sustainability for the future generations. Here are some of the negatives of working in the NHS. Working for the NHS in the UK presents both advantages and disadvantages. Job security, benefits, professional development, and the opportunity to make a difference are all positive aspects of an NHS career. However, low pay, staff shortages, too much bureaucracy, and limited resources are truly potential drawbacks. It is these drawbacks that push the staff to jumping ship and head to private healthcare, where they are offered higher salaries, performance-based pay, and financial incentives. This can include bonuses, performance-based pay, and other monetary rewards, and not to mention potentially lucrative compensation package. Private healthcare facilities are often well-funded, equipped with cutting-edge medical technology, and maintained to high standards. This allows healthcare professionals to work with advanced equipment and have access to the latest medical innovations. The number of medical and non-medical staffing vacancies remains very high in the NHS. This is partly made worse by the current pension issues and pay cuts for medical and non-medical staff, which has forced them to abandon healthcare or move overseas. Despite the government plan to increase the number of medical school placements over the years, this is unlikely to solve the problem due to the lack of retention plan. Lots of graduates are already thinking about going overseas or taking a gap years due to the enormous amount of pressure they are under during training period. They need to start thinking about recommendations and interventions. It is time to start addressing these key challenges. For example, it is very unlikely to retain healthcare staff without offering attractive pay offers, opportunities for flexible working, and clearer career pathways. The staff well-being should be at the heart of the NHS reformation, and they should be given time, space, and resources to recover in order to deliver the best possible care to their patients. More must be done to tackle racism and discrimination within the NHS, and equal opportunities should be provided to minority healthcare workers and social care workers. This can be done in several ways. The most important step is to acknowledge that this exists in the first place. All staff members should be provided training to recognize racism and empower them to take actions to tackle racism within the workplace. Similarly, steps should be taken to create equal opportunities for staff from the BAME community for career progression and development. There is need at the leadership level to develop and show compassion to the frontline staff. The government needs to take steps and create policies to tackle the inequalities steeped up within the NHS. Senior staff tend to look down on the Band 2 staff. This is wrong and should be corrected as soon as possible.